Welcome back, PsyQ community. Becky Wong here from the Otsuka Field Medical Affairs team, and welcome to today's recording, the 12 Steps to Inclusivity in Mental Health Services, part 2 of 4. Thank you for joining us. Today's recording sponsored by Otsuka Pharmaceutical Development and Commercialization Inc. and Lumbeck LLC. I am an employee of Otsuka, and our speaker is a paid consultant for Otsuka. Materials were developed in collaboration with our featured speaker, Dr. April Thames. Before we begin, I would like to take a moment to introduce our featured speaker. Dr. Thames is the Professor of Psychiatry, Chief Psychologist of Adult Division in Psychiatry, and Associate Director of Medical Psychology Assessment Center at UCLA School of Medicine, and was a past associate professor and clinical neuropsychologist in the departments of Psychology and Psychiatry at the University of Southern California. She has led several projects funded by organizations such as National Institute of Health, Alzheimer's Association, and Robert Wood Johnson Foundation. Broadly, her work focuses on social determinants of cognitive health with a focus on how racial, ethnic, and socioeconomic disparities impact cognitive and mental health outcomes. Thank you, Dr. Thames, for joining us. And without further ado, I will turn it over to her so that she can walk us through the second series.
Thank you, and hello, PsyQ community. I'm really happy to be talking about this very important topic. And in the last series, we discussed some of the things that the provider can do in preparing for the first encounter, which is what we will talk about in this series. We all know that the first encounter with a new patient can be anxiety provoking, and even more so if the provider is working with a patient from a different cultural background. Now, obviously, for some individuals providers who are new in their role and maybe just fresh out of medical school or graduate school, it can be very anxiety provoking. Those later in their careers may feel more confident, but nevertheless, we all feel some sort of angst when we are about to have an encounter with somebody that is from a different background than our own. So keep in mind, you are not expected to know everything about a specific population or how an individual client endorses or engages in specific cultural practices, beliefs, or values. That is not the expectation. But what the expectation for us providers should be is to ensure that we demonstrate cultural humility, sensitivity, and responsiveness, and that we do our best to prepare and reflect at every stage of the process of the patient-provider interaction. Okay, so handling the referral. The referral is really the first encounter. It's not seeing the patient directly. When we think about referrals, they're usually pretty quick. We sort of review the question that the other provider is asking, and we move from there. But there are questions that we can ask ourselves to start thinking about the referral in a more thoughtful and in a more cultural, inclusive way. The first question we can ask is, what do I know about this client's background? Can I glean anything from the medical records about their racial ethnic identity, their cultural beliefs, where they live, what their occupation is? There's a lot of questions that we can answer simply by looking at the records, if available, and whatever is written down in the referral summary. We can also, if we have information about the patient's cultural background, we can think about, well, what do I know about this culture? What do I know about how they may view mental illness and mental health? What research do I need to do before I meet with this client? If the client has multiple medical conditions and some of those conditions we may be not as familiar with, we might want to do our research to find out what those actually are and how that may be impacting the client. And we also want to think about how might, and not stereotyping because we don't know, but how might someone from this particular culture view medications, view psychotherapy, and thinking about, do I need consultation from a colleague who either works primarily with people from this cultural group or who is a member of that cultural group? So there's a lot of work that we can do just based upon the referral. Okay, so the next step is when you actually meet clients for the first time. And as we all know, most of human communication is through nonverbals. And so as we think about how to connect with our client in that initial encounter, we're going to use a lot of nonverbal behaviors. So when thinking about how to greet clients, providing simple gestures such as a handshake, having a warm facial expression, inviting, and also maybe taking time to establish small talk, because that is going to help build the therapeutic relationship. Jumping into questions right away or treating the client like, I don't have a lot of time, so let's get this through, that is not going to help them feel comfortable talking with you about any issues that they're experiencing with regard to mental health. We want to avoid use of jargon, and we want to make sure that if we're using an interpreter, that the client feels engaged with the interpreter. So we want to talk to the interpreter ahead of time. You never want to enter an encounter and yourself just be meeting this interpreter for the first time, because you want to make sure you set the stage that it's going to be a comfortable interaction. If a family member joins, you want to make sure that the family member feels engaged, because more likely than not, that family member is going to have more influence on that client following any therapeutic recommendation that you provide than you will yourself as the provider. And once you have established rapport, then it's important to gather information about some potential barriers that the client perceives for adhering to treatment. So there are barriers to mental health care, and one comes from the practitioner view and the client view. So I want to talk about the practitioner view. Up to this point, we have discussed a number of techniques that can help to increase one's own cultural responsiveness. But as we all know, we don't all work in the most ideal settings. And so we need to recognize the limitations of the context, but not to become discouraged by them. We need to think about limits of a setting actually can create an opportunity for organizational change. And if you find yourself in a setting that is less culturally responsive, or there's just not a lot of resources and materials to rely on, you as the provider can make a big difference in starting to get involved. So one is that we can review our program's mission statement. The mission statement should explicitly state that cultural competence is a core value. And policies, we need to look at the policies and how, whether or not they respect cultural diversity of program clients, staff members, and the community. Reviewing training materials in the areas of cultural diversity, inclusivity, and service delivery are very important. Most of the time, these materials can be outdated because we are constantly learning something new every day in this area of cultural diversity and inclusivity. And if you're using old training materials, that is not going to be very helpful, because I know back when I was a student in graduate school, we were taught this group does this and this group does that, and it was very cookie cutter and very stereotypical. And that is not how we want to move forward. Although that was appropriate at the time because you're trying to bring awareness that people are different and they have different views, our field has advanced very much so since then. And so we want to make sure that we are up to date with the best practices. There are also ways to think about the demographics of the clientele relative to the numbers of racial, ethnic, and sexual minorities in the larger area. So if you find that your facility or your institution is primarily serving people who live around the area, that is a problem as it comes to trying to provide equitable health services. And a facility's appearance can also make a big deal. So thinking about how is the treatment facility decorated? Is there a warm vibe that it's inclusive and respectful of people from different cultures? And what's the artwork on the walls look like? These are ways that we can look around and see how inviting is our facility. And let's say we don't know what to do, we don't know what we're doing. It's really important to network with other groups that do a good job at fostering inclusivity and diversity in client services, because maybe they can serve as a consultant for your facility or for whatever space that you're in to make sure that you are providing an inclusive environment. Now, as it comes to the client, there are sort of two buckets of barriers to mental health care. And even in the most culturally inclusive mental health care space, we are going to experience challenges with engaging clients. It's just a fact that we all have to face. But there are questions that you can ask the client to assess two main areas. One is client attitude, and the other is client self-efficacy. So client attitudes, and I won't go through all the questions, but it's important to get a sense of why is the client seeing you today? Why now? How do they perceive mental health treatment? Do they know anyone who has undergone mental health treatment? Those kind of questions can be really helpful with getting a sense of how your client views mental health care. Also, if your client is from a cultural group that lives in a small community, they may be very concerned about receiving mental health services that somebody might find out, taking medications. It can, they might be afraid that the stigma will spread like wildfire through their community. And so it's really important to get a sense of that. The second area is client self-efficacy. So what this refers to is how does the client perceive their ability to access mental health care and stick with the recommendations? And so some questions that the provider can ask are questions such as, do you think that you will feel like seeing me every month, week, however long the duration is? Do you feel that you have enough support and resources to continue treatment? And an important question to ask is, do you think you would feel comfortable telling me if you are not happy with treatment? And this is something we do not ask, and clients and patients do not want to tell us if they are not happy with our services. For the most part, and certain cultural groups will never challenge the doctor. That's just not part of what they do. And we have to allow a space for that honesty, even though we may not be accustomed to being criticized, nor do we want to be, but it's important for us to be open to hearing our patients' perspectives. So I hope that this series has been helpful for thinking about certain barriers to receiving mental health care, thinking about the setting, thinking about what you can do to advocate for more inclusive services, and also to engage your client in a conversation to really get a sense of their attitudes towards mental health, as well as their perception of their ability to stick through treatment.
Thank you, Dr. Thames. We would like to invite you to please join us for part 3 of the 12 step to inclusivity in mental health services. Thank you.